Good evening. My name is Courtney Duffy, and I'm a certified nurse midwife here at KSB Hospital. I have a doctorate in nursing practice, and I just want to talk a little bit about what a midwife is. So, midwife is a nurse that's obtained a master's or a doctorate in nursing with a concentration in midwifery. So, midwives provide specialized women's health care starting at puberty and continuing through a woman's life. Midwives are able to provide obstetrical and gynecological care. They deliver babies, prescribe birth control medications, screen for STDs, provide hormone replacement therapy. That's just to provide a few. So National Women's Week is May 14th to 20th of this year, and I'm here to discuss some ways to empower women's health by partnering with your provider to ensure you're healthy and continue to live a healthy life. It's very important that women have an appointment with their women's health care provider at least every 2 years, but preferably every year. This is to provide preventable health care such as vaccinations, cervical cancer screening, breast cancer screening, and to discuss any other questions that you may have. Cervical cancer screening is one preventable cancer that can have a good prognosis if found early. One such way is to see your women's healthcare provider to be screened. Ways to lower your risk is by receiving the HPV vaccine. The current recommendation is up to age 45 of having high-risk sexual behavior. Cervical cancer screening tests are important to receive regularly. Right now, the recommendation is to start receiving pap smears starting at age 21. A pap smear is a procedure where we use a speculum and take a sample of your cervical cells to look under a microscope for any irregular cells or the HPV virus. There's no special preparation prior to your pap smear, but please do not have intercourse or insert any vaginal medication for at least 48 hours prior to your appointment. Breast cancer is another cancer that we aim to help catch early for a better prognosis. One way to catch it early is to obtain a mammogram yearly starting at age 40. This should be done annually unless you have any problems. You should also obtain a clinical breast exam yearly starting at age 40, and this can aid in early detection. You should also have a well woman exam. We prefer every year that you can discuss these screening tests and also other tests such as labs to ensure that you're healthy. We can discuss birth control options, menopause education, and any other information that you want. Your provider will engage in a shared decision-making with you so that you have all the recommendations and information for you to make a decision. At your well woman exam, you may have a physical exam, such as a clinical breast exam, to help educate you on your breast and to find any abnormal lumps. The physical exam can also include a pelvic exam that allows us to view your vaginal tissues to find any abnormalities early. And finally, there's different ways to help keep healthy, such as eating a balanced diet, keeping active and exercising, avoiding excessive alcohol, obtaining at least 7 hours of sleep, practicing safe sex, and obtaining regular checkups. Thank you for listening, and please come see us at KSB Women's Health Clinic.